Most men will never talk about this. Not to their doctor, not to their partner, not even to themselves. They'll notice something's off, tell themselves it's nothing, and keep going. And that silence, that one decision to look away, is exactly how permanent damage begins. I've been a urologist for over 22 years. My name is Dr. Marcus Hale, and I specialize in male sexual and urological health. I've seen thousands of patients walk through my door, CEOs, teachers, college athletes, retired veterans, and almost every single one of them said the same thing when they finally sat down across from me. I wish I'd come in sooner. There was one patient I still think about, 43 years old, ran his own business. He came in with a problem he'd been ignoring for 8 months. 8 months. He'd rationalized it, minimized it, told himself he was too busy. By the time I saw him, what should have been a simple, early-stage conversation had become something far more complicated. He looked at me across the desk and said, "Nobody ever told me this could happen. And that's why I make these videos, because nobody told him. And I'm not going to let that happen to you. Let's start with something almost every man does without thinking about it. And I want you to really hear this, because this one alone is responsible for more damage than most men realize: ignoring pain during sex and pushing through it. The common assumption is that pain is temporary, that if it happened once, it's probably nothing, that real men don't make a big deal out of discomfort. That logic gets men hurt. When you experience pain during intercourse, a sharp pull, a deep ache, a sensation that something isn't right, your body is sending a specific signal. That pain is neurological and vascular communication. Your tissues are telling you that stress is being applied in a direction or at a force that causes micro-tearing in the tunica albuginea, the thick fibrous sheath that encases the erectile tissue. I always explain it to patients this way. Think of it like repeatedly bending a garden hose sharply at the same spot. The first few times, nothing visible happens. But inside the material, the structure is weakening. One day it kinks, it cracks, and the water stops flowing the way it should. The Journal of Sexual Medicine published findings showing that repeated microtrauma to penile tissue, even without a single dramatic injury, contributes significantly to Peyronie's disease, a condition involving scar tissue buildup that causes painful curved erections and, in advanced cases, the inability to achieve penetration at all. Peyronie's affects an estimated 1 in 11 men at some point in their lives. That's not a rare condition. That's your neighbor, your coworker, possibly you. The practical action here is simple. Pain during sex is not a performance note. It is a stop sign. Slow down, change position, or stop entirely. One uncomfortable conversation is worth infinitely more than a condition you'll manage for the rest of your life. But here's what makes this even more concerning, because the damage doesn't only happen during sex. Aggressive or improper masturbation technique. Most men have never been told there's a right and wrong way. It sounds almost absurd to say out loud, but this is one of the most common causes of long-term penile tissue damage I see, and it almost never gets discussed in any public health space. The problem isn't frequency, it's force, angle, and the absence of lubrication. Friction against dry tissue creates chronic superficial microdamage. Over time, this can lead to desensitization, a reduction in nerve responsiveness that men often describe as needing more and more stimulation to feel the same sensation. I explain it to patients this way. It's like pressing your fingertip against a rough surface every day for a year. At first, it's sensitive. After a while, the skin thickens, the nerves adapt downward, and what you could once feel clearly becomes muffled. Research published in the British Journal of Urology International found that compressive grip force and dry friction were associated with reduced penile sensitivity in men who reported high-frequency masturbation without lubrication. This isn't about shame or frequency, it's about tissue health. And lost sensitivity rarely comes back fully once the nerve pathways adapt. Use lubrication. Vary technique. And if you've noticed that sensation has diminished over time, that's not normal aging, and it's not in your head. It's worth a conversation with a urologist. I want to pause here and ask you something directly. Have you ever noticed something? A curve that wasn't there before, a moment of pain you dismissed, a change in sensation you told yourself was just stress, and done nothing about it? If that's you, type yes in the comments. I promise you, you're not alone. And I want to know, because what I'm about to cover next is exactly why that silence matters. Tight clothing and prolonged compression. This one sounds almost too simple to be serious. It's not. The penis requires consistent, unrestricted blood flow, not just during arousal, but throughout the day. The corpora cavernosa, the two chambers of erectile tissue, depend on regular oxygen delivery through small arterial vessels. When sustained pressure is applied through overly tight underwear, compression from certain seated positions, or tight athletic gear worn for extended periods, you're partially restricting that vascular supply. Think of it like leaving a rubber band around your wrist all day. Your hand stays functional. The circulation isn't cut off completely, but the tissue is chronically underperfused, getting less than it needs repeatedly over months and years. A study in the International Journal of Impotence Research found a measurable association between chronic pelvic and genital compression in cyclists, particularly those riding more than 3 hours per week on standard saddles, and reduced erectile function. The mechanism isn't dramatic. It's gradual, and gradual is exactly why men miss it. The daily action. Choose underwear that supports without compressing. If you cycle, a split or no-nose saddle matters more than most men think. And if you work a desk job and you've noticed that your morning erections, which are one of the most reliable indicators of vascular and neurological health, have become less frequent or less firm, that detail is worth paying attention to. And it connects directly to something I almost never see discussed, but I think about more than almost anything else in my practice: what heat is doing to your tissue and your fertility over time. The scrotum exists outside the body for a precise biological reason. Testicular function requires a temperature approximately 2 degrees Celsius below core body temperature. That's not a preference. That's a strict physiological requirement. Sperm production, spermatogenesis, is exquisitely temperature sensitive. Even a modest chronic elevation can suppress production significantly. But beyond fertility, sustained heat exposure to penile and scrotal tissue, from laptops on the lap for hours, from heated car seats, from prolonged hot tub use, from tight synthetic fabrics that trap heat, creates a chronic, low-grade thermal stress environment. I always describe it to patients as this: if you put a plant under a grow light for the optimal amount of time, it thrives. If you leave the light on indefinitely, the same plant wilts. Heat isn't inherently damaging. Chronic, uninterrupted heat, the kind that never gives the tissue a rest, is. The World Health Organization has flagged scrotal heat exposure as a meaningful contributor to declining male fertility rates globally. And the American Urological Association's own research has linked chronic scrotal hyperthermia to elevated DNA fragmentation in sperm, meaning not just reduced count, but reduced quality. Practical change tonight. If you use a laptop, use a desk. If you sit in a heated seat for your full commute, turn it off for the last 20 minutes. These aren't dramatic sacrifices. They're the difference between slow, invisible damage and tissue that functions the way it's supposed to. Now I need to slow down for a moment, because this next one is the one that keeps me up at night professionally. I have never seen this in a patient brochure. I have never heard it discussed in a primary care setting. And in my 22 years, I can count on one hand how many men came to me knowing this was even possible, ignoring the early signs of vascular compromise, and what it actually means for the rest of your health. Here's what most people don't understand. The penis is a vascular organ. Its function is almost entirely dependent on blood flow. And because the arteries that supply it are small, significantly smaller than the coronary arteries of the heart, they show the signs of vascular damage years before the heart does. Let that sit for a moment. Erectile dysfunction that is not caused by psychological factors, medications, or hormone imbalance is, in the majority of cases, an early warning sign of systemic cardiovascular disease. The Princeton Consensus, a landmark series of guidelines developed by leading cardiologists and urologists,
established that new-onset ED in a man under 60 should be treated as a cardiac risk event until proven otherwise. A study published in the Journal of the American College of Cardiology found that men with erectile dysfunction had a 59% increased risk of coronary artery disease, a 34% increased risk of stroke, and a 33% increased risk of all-cause mortality compared to men without it. These aren't small numbers. These are life-altering numbers. I always explain it this way. If the smallest pipes in your house are clogged, the bigger ones are already compromised too. You just can't see it yet from the outside. The penis is your earliest warning system. Most men treat it as a problem to be embarrassed about. It is, in reality, one of the most valuable diagnostic signals your body produces. When Marcus, the patient I mentioned at the beginning, finally came in, the issue he'd been ignoring for 8 months wasn't just a local problem. His blood work and follow-up imaging revealed early atherosclerotic changes in his femoral artery. He was 43 years old. He had no chest pain, no prior cardiac history. His cardiologist told him directly, the fact that he came to see me when he did may have saved him from a heart attack in his 50s. He didn't know, because nobody told him. I'm telling you now, if you've experienced a gradual decline in erectile function, not a single bad night but a persistent progressive change over months, do not wait. Do not rationalize. Do not look up supplements on the internet. Get your lipid panel, your HbA1c, your blood pressure, and your testosterone checked. See a urologist. See a cardiologist if your urologist recommends it. This isn't about sexual performance. It's about your life. Share this video, not for the algorithm, not for the channel, because there is a man in your life, a father, a brother, a friend, who has noticed something and said nothing. And you might be about to give him the information that changes what happens to him in 10 years. Tag him. Send it to him directly. You don't need to say anything. The video will say it for you. Tonight, I want you to do one thing. Just one. Think honestly about whether there is something you've been noticing and pushing aside. A change, a discomfort, a quiet signal you've been too busy or too uncomfortable to follow up on. You are not too young for this to matter. You are not too old for it to be worth addressing. And you are not too busy for the 3 minutes it takes to call and make an appointment. Marcus came in 8 months late. He's okay. Not everyone is that fortunate. The information exists. The care exists. The only thing standing between where you are and where you need to be is the decision to stop looking away. Make the call tonight.